Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to empowering and educating women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton, and I'm a maternity pediatric chiropractor as well as mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. And this podcast episode was sponsored by Informed Pregnancy Plus. That's a fantastic streaming platform for pregnancy and parenting. You can experience it for free at informedpregnancy.tv. Today's episode is on the woman's journey from fertility through the menopause transition with Dr. Maria Sophocles. Dr. Maria Sophocles is a woman's sexual health advocate, and she's a board-certified OB-GYN, certified menopausal specialist, and the founder and medical director of Women's Healthcare of Princeton, which is a progressive and innovative women's health practice in Princeton, New Jersey. Since earning her medical degree from Jefferson Medical College of Thomas Jefferson University in Philly and completing her residency at Johns Hopkins Greater Baltimore Medical Center, Dr. Sophocles has been a leader in her field, embracing cutting-edge technology such as advanced, non-invasive, non-hormonal gynecological procedures to treat such issues as vaginal dryness, painful intercourse, and lichen sclerosus. Dr. Sophocles is a respected opinion leader on topics related to menopause and female sexual dysfunction, and is a member of numerous prestigious organizations, including the American College of Obstetricians and Gynecologists, the North American Menopause Society, and the International Society for the Study of Women's Sexual Health. Additionally, she is a fellow of the American Board of Obstetrics and Gynecology and the International Society for the Study of Vulvovaginal Disease. For more information on Dr. Maria Sophocles, visit PrincetonGYN.com. Hi, Dr. Sophocles. Welcome to the show. I'm very happy to have you on today.
Hi, Laura. It's really nice to be here. Thank you for having me.
So this is going to be a really interesting podcast because as an OB-GYN, well, you're really focusing on GYN in your practice. You are a woman's sexual health advocate. And so that is somewhat unique, I think, within your profession. And you have a lot to add and offer to the women listening today that are having challenges around their sexual health.
Yeah, I mean, sexual issues are much more common than we want to believe and that we talk about. I think we feel like we're living in a very progressive era, and certainly there's been a coming out of the closet of sexual issues and use of sex toys and lubes and all kinds of promising things. But there's still over 50% of women have sexual dysfunction at some point in their life. And certainly around pregnancy, during pregnancy, after pregnancy, a number of women have issues that they never had before. And they're often in their 20s or 30s or early 40s and feeling extremely frustrated by the fact that they didn't think these things would be an issue for them at this time in their life.
Right. I think a lot of women think that this is something that might happen once you're menopausal and, the vaginal dryness, things like that. But hormonal shifts can happen, like you mentioned, at any age and can wreak havoc with not only the physical comfort, but then also the emotional wanting, right? The libido, which
Correct.
plays a very big part in sexual health. Because sexual health is not just having sex, it's enjoying it and it's having orgasms and everything that goes into wanting to have that interaction.
Right. And many women really want to resume their sort of pre-pregnancy life. And a facet of that is their pre-pregnancy sex life. And many studies show that there can be a span of up to 18 months after the birth of a child before women really regain that. And I think many women are shocked to find that especially if they feel well, maybe they had a really easy delivery and their episiotomy is healed if they had one or whatever. And then they are not, they're forgetting that they're not sleeping the same, that there's another baby that they're thinking about, that their body has undergone a lot of changes. And as you mentioned, there've been tremendous hormonal, shifts or chaos, as I call it, and that this can affect everything from vaginal lubrication to difficulty reaching orgasm to libido. So I think these things are worth talking about because many doctors don't. Honestly, they're happy that your C-section scar healed and that's enough,
I agree. I have women in my practice who are feeling frustrated about that and have even had their doctor tell them, "Oh, a male doctor, have a glass of wine, so you can have sex with your husband," right? And it's like, well, no, this is not that's not the solution here, right?
Demeaning because it's saying maybe you're just too uptight, and if you just relax with some wine, you'll be fine.
Correct.
I find it demeaning and belittling to assume that your female patient doesn't really know what she needs, or it's probably all in her head, quote unquote. And I've had women come to me and their doctor hasn't even checked them after the delivery. They sort of just patted their hand and said, have a glass of wine. And meanwhile, there was a tear that hadn't healed right, or really severe vaginal dryness, or really severe emotional discord, feeling like your body isn't yours anymore, or even that because you're breastfeeding, your breasts are different, or, there's so many changes and there's so many ways we can feel happy that we had a healthy baby, but still not feel happy about maybe how our body looks or how we feel, or are we enticing and alluring as a sex partner. And it's funny because when they do studies and ask men, are you still attracted to your wife after delivery? The men say 100% yes. Or are you, if the woman gains 50 pounds and they ask the man, are you still attracted? They say, what 50 pounds? Yes, of course. But that doesn't mean a woman doesn't feel different with an extra 50 pounds that maybe she hasn't lost, or stretch marks, or a C-section scar. And doctors are busy, so we'll grant them that. They may be just too busy to have time to ask this, but I kind of call BS on that. I think if you're really caring for a patient during and after a pregnancy, you've got to care for her emotional health and her happiness, and part of that is her sexual health.
Yes. And we do know that these hormonal fluctuations that occur, during pregnancy, after giving birth, are somewhat that's part of the whole perinatal journey, but there could be extremes, right? So we'll see some women with postpartum depression or postpartum anxiety. And I can only imagine that would also impact libido and, wanting to have sex, right?
For sure. I mean, postpartum depression, we know, is also underreported and underdiagnosed, and women just feel, I guess I'm just tired, whatever. But, if you're not wanting to get out of the bed and you're not wanting to breastfeed, then it's likely that you have some level of postpartum depression. So it wouldn't be crazy to say, gosh, having sex is just too steep a hill to climb. Yeah.
Right. And to your point, these are, really underdiagnosed. I think a lot of women, as new moms, and they are exhausted and they're figuring out how to mother this new baby. And there's a lot of challenges that are happening. And they kind of sometimes just feel like, well, I have to sacrifice my health, my mental, emotional, and physical health to care for this baby, right? Because I'm excited to be a mom. I'm so happy my baby's here, and my baby's needs come first. And newborns have a lot of needs.
Sure. So what we know is that sexual health is an important part of overall health, and that for a new mom, they often feel like they can't ask their doctor about sexual issues. Either they're embarrassed, or they get the sense the doctor is embarrassed, or the doctor is too busy. And often clinicians give this vibe off because they don't want to be asked about sex, because they're uncomfortable. And so few clinicians are trained to deal with sexual issues. This is a huge problem, and it's not your fault as a patient, but you can do something about it. You certainly can look up clinicians who have an interest and ability to treat sexual function. There is a society called ISSWSH, the International Society for the Study of Women's Sexual Health, ISSWSH. And ISSWSH is nurse practitioners, physician's assistants, physicians, chiropractors, pelvic floor physical therapists, a group of people who all feel that sexual health is worth studying and treating and talking about. So you could always go on that website and find someone in your zip code. Because
That's a great idea.
many OB-GYNs simply aren't comfortable. And that's why they say have a glass of wine. They weren't trained, or they're bringing their own baggage from their upbringing where their parents told them don't talk about it, or they've never had a baby.
Right.
Or they don't have a vagina and perineum. There are lots of reasons. But what we find when we really study medical education and what goes on in an exam room is that very, very few clinicians preemptively will say, are you having sex and is it comfortable? So when I train clinicians to talk about sex and bring sexual medicine into their practice, I try to keep it really simple because they all say, well, I don't have time, I'm busy. And I say, well, all you have to do is say, are you having sex and is it comfortable for you?
Right.
Because if it's uncomfortable, I think someone will say, yeah, it's painful. Or hopefully they'll say, it's comfortable, but I'm not enjoying it. And if they don't volunteer that, I will say, do you have desire or interest? That's, of course, the number one most prevalent sexual dysfunction in women after having a baby is the
libido
interest. Yeah, which makes sense because I think they're so exhausted. And as you said, Laura, their brain is so focused on, I've got to sacrifice everything for this baby. And I would push back a little and say, actually, you don't. You don't. Your sleep and your happiness are totally okay not to sacrifice.
Yeah, it's really important. That's where support is so important too, right?
Totally.
It's too much for a mom to do all by herself.
Totally. So just to underscore how prevalent sexual dysfunction is postpartum. So in the 2 to 3 months after birth, the prevalence rate somewhere between 40 and 80%. So, if you go out in a mom's group, and there's a dozen of you, probably 6 or 7 of you are having sexual dysfunction,
And that raises an interesting point. So I had a fairly uncomplicated vaginal delivery. And I remember the first time having sex after giving birth to my son. And it wasn't that comfortable. I feel like the tissues were somewhat healing. I don't remember if it was 4 or 5 weeks postpartum, but it does take time. Even if I didn't have any tearing, I didn't have any stitches, but, my vaginal wall had some abrasions and that's what I was feeling when I was having sex. And it was not, it was still uncomfortable. So, is there a certain timeline of how women should wait before they have sex after birth or?
No, there's not a fixed timeline because of course we're all different. Some people will have horrific damage and tearing and whatever. Others will not. Some women are 48 when they have that vaginal birth and their cells turn over more slowly, so they will heal more slowly than a 19-year-old or a 25-year-old. So we heal differently at different ages. And in general, the older you are when you give birth, the more slow things are to come back to pre-pregnancy. But it also depends, if you had a C-section, you may not have any vaginal tearing or anything at all, but you may have, many women just have fear, even with no injury, that they just fear it's going to hurt because it's been a while. It's sort of like being out of shape and going back to the gym. It's like, I just know this is going to be hard for me. And that's a normal feeling. And I would say, not to have a glass of wine, although a glass of wine is always nice, but I would say give yourself permission to take it slow and to maybe not focus on penetrative sex that first time.
Right.
But just focus on cuddling, on intimacy, on touching, on feeling your brain re-engage before your body does. And then, even if that's all that happens, believe it or not, the female brain stores that. And then the next time that you and your partner are cuddling and thinking of having sex, you will be more game to proceed with something that might involve vaginal penetration. But don't feel you have to do that for him.
Right. It feels safer is what you're saying for that woman's brain. And that's huge, right? Safety is huge. I have women in my practice who've had PTSD post-delivery. And I can see why that would also very much impact their sexual health, right?
Yeah, for sure. We have a lot of patients at my clinic in New Jersey who come to us because they struggle to have sex at all, pregnant or not pregnant, because of sexual trauma or childhood events or a bad
Abuse.
marriage or infidelity,
Mm.
the husband gave them warts or something that then even after their delivery, it triggers and they're feeling it again, or they feel they're worried about the warts that they no longer even have, or the assault from when they were in college, or, there's so many things that can come up for us. And remember, when we're sleep deprived, there's so much emotional lability. It's so easy to get teary, to get anxious, to have our fears surface.
Mm.
So all of this comes to play in those first months after we have a baby. This is why even 6 months after giving birth, about 64% of women will still have some sexual issues. So, be patient with yourself. And if you feel there are other factors, let's say there's PTSD, or things are surfacing for you about your relationship that you can't get over now that you've just had a baby, it's really not inappropriate at all. It's really fine to say, I think I'd like to talk to a therapist. And there are therapists who just deal with sexual trauma. There are therapists who just deal with sexual dysfunction. And a great website to find, when I say sex therapist, people always think I mean, oh, you don't know how to have sex. And they go, no, I don't need a sex therapist. That's not what I'm talking about. I'm talking about a therapist who really understands holistically the sexual experience and will dig in with you deeply to what might be behind your issues. They may be issues related to your family, or your former partner, or your first husband, or a traumatic childbirth. And a good therapist will uncover that, but someone who's trained in sex therapy will actually know how to move forward from that information into how to translate that into what you can do sexually. Maybe you can't have penetration now, but maybe you can have oral sex, or maybe you can just cuddle one afternoon a week. I mean, they'll meet you where you need to be met. So the website is aasect.com, AASECT, AASECT. And I don't kill me if I get this wrong, but I think it's American Association of Sex Educators, Counselors, and Therapists. AASECT. So you could look up in your zip code an AASECT trained therapist, and that's going to be someone who's really going to be empathic about what's happening sexually, because your OB-GYN may not give you the answers you need. And I say that as a proud OB-GYN, but aware of our own deficiencies.
Yeah. And so what also I find is there could be a physical issue, right, causing the sex dysfunction. And typically we'll see if that's prolonged, emotional comes with it, right? So they kind of almost go together because we can't separate the mind and body. So let's say a woman's in your practice recently after giving birth, maybe even 1 year, and is having sexual dysfunction. Tell me what you would do to help her treat the physical. And then I'm assuming you also co-treat with a therapist or somebody who specializes in this as well.
Exactly. So I also studied as an AASECT therapist. So luckily for me, I can do that part.
You do both.
I do, but 99% of OB-GYNs do not. So for most listeners out there, their OB-GYN is, I hope, got in their top drawer a list or a name of an AASECT trained therapist. And that's
or they can look it up on the website.
Look it up, right. But for the physical, sometimes we treat with vaginal estrogen. We just say, wow, these are really bad tears. And especially in someone who's perimenopause, kind of mid 40s, just had a baby, a little topical vaginal estrogen is super safe. We usually do it in someone who's not breastfeeding because breastfeeding is possible. Some could get to the baby, although it's super low dose. There are all kinds of vaginal moisturizers out there. Vaginal moisturizers are not lubes that you use during sex, but they're suppositories or gels or creams that you insert in the vagina about twice a week, and they maintain a moist environment. They actually have hyaluronic acid in them, which is what's used in high-end cosmetics. I tell people it's robbing Peter to pay Paul. It pulls the moisture from behind the walls of the vagina into the vagina. So it's not creating new moisture, but it's pulling the moisture into the place that you need it. You could, literally insert a little suppository on a Monday and a Thursday and at least have a more moist feeling vagina, which a lot of women like, and they're super safe. You buy them.
Do you have to drink more water?
You don't have to. It's not that they don't recommend yes or no, but if it makes sense that the better hydrated you are, there's a bigger pool to pull from.
Right.
So there are several companies that make hyaluronic acid products for the vagina. And as I said, they're safe. They're over the counter. You can order them online. And you can even just Google hyaluronic acid containing vaginal moisturizer. That's HYALURONIC, hyaluronic acid. Easy,
cool.
Easy.
Yeah. And then what else? Like, what if there's really tight muscles?
Sure. So, so the other thing, I'll just finish with lubrication, is time. Of course, taking time to be lubricated will allow the moisture that you have to seep through the walls so that you're more lubricated when you do have sex. In terms of kind of, injuries, I guess, or healing, they come in two flavors, really. There's the surface, the cuts or the tears, and we sort of talked about that. And then there's the pelvic floor muscles beneath the cervix. I almost said cervix. And those muscles it's really helpful to learn about those muscles from a pelvic floor physical therapist, which is very underused in this country. In France, when you have a baby, you automatically get to have pelvic floor physical therapy for free. Our country doesn't really value that as much, but I
value it. I send all my new mamas to pelvic PT to get an evaluation, even if you have no issues. You just get checked out.
Well, they're lucky to have you, because I don't think so many OB-GYNs use them. And it may be that we're trained as surgeons, that we're sort of like, fix something that's bleeding. I don't know. But I think the popularity is gaining to use pelvic floor physical therapists as an adjunct to help women postpartum really get their urinary function back on track and their sexual function improved. Pelvic pain can be reduced. There is no shortage of the benefits to pelvic floor physical therapy. I know it's time and money, and many people are lacking in one or the other or both of those, but I do find it's an investment well worth it.
I agree. And as a chiropractor, I do see, even like after giving birth, having a woman's pelvis checked for the alignment, which is obviously can be somewhat skewy after especially after a vaginal delivery, but even just going through pregnancy puts a lot of stress and strain on the joints and ligaments and tendons. And so that also, the pelvic floor muscles connect to that pelvic girdle. So they go hand in hand. This episode is brought to you by Informed Pregnancy Plus, the ultimate streaming platform for expectant and new parents. Dive into a rich collection of insightful videos, from iconic films from Ricky Lake's The Business of Being Born to The Empowering Orgasmic Birth, and many others, including my documentary. Explore the mind-body section with meditation, yoga, and fitness classes, including Baby by Simone and Belly Dance for Birth, all with your subscription. Delve into workshops, book insights, and TV-style series covering everything from fertility to breastfeeding. It's a must-have for moms-to-be and birthing professionals. And with apps available for Apple, Android, and Roku, streaming is a breeze. The best part? Try Informed Pregnancy Plus for free. Visit informedpregnancy.tv and start today.
Yeah, exactly. I mean, I won't even try to do justice to what you just said, because you said it so beautifully, but it's a sort of a synergy between all of it. And when it's all working together, that's when women go, "Oh, I'm back to me." And I think you've probably seen that in your patients
I've seen it. And I do find, and we touched on this a little bit, but the moms that really just sacrifice their everything for this baby, are the ones that are suffering the most, because they are so depleted. We know, the newborn phase is exhausting. And, if you're a breastfeeding mom, you are waking up, but, being able to take naps during the day can be hugely beneficial. So you're not going on 3 to 4 hours of sleep total in a day, right? Like that's just, Just it's
Right.
very
And if
hard to
you're doing
function.
that, then going to pelvic floor PT is is not on your radar already. You're
Correct.
barely getting through the
You're
day.
barely, it's like very survival. And there's not, there's unfortunately you miss that opportunity to really connect and bond as well, right? With your baby, which is like the most exciting thing.
Yes, you feel like I'm killing myself. I'm doing the best I can, but it actually works against you. And I'm guilty. I remember with my first child, that feeling of I have to do everything and be on it 24/7. And all you really do is wipe yourself out to a point where you're not really good for anybody.
Right.
Not for the baby, not for your partner, not for your relatives and friends who want to come see the baby and you're barely functioning. It really, and I think it's funny. Women often have a hard time asking for help. Like,
Mhm.
I can do it. I can do it. And I would say,
Mhm.
this is probably a good life chapter where you ask for help, whether it's spending money on a nanny or a caregiver
Mhm.
or getting someone to watch the baby so you can walk every day, or
Mhm.
getting to a postpartum exercise class. All
Mhm.
these little steps help
Mhm.
return you to being the fully functional person that then allows you to be more engaged meaningfully with the baby and everyone else.
Yeah, and you really made an interesting point where I do find it's like the type A driven woman who's so successful in her career and now becomes a mom is the one that has sometimes the hardest time asking for help, because she's been so independent and she's like, I can do it all. Look what I've done professionally. And it's this new chapter is like, whoa, I've never been a mama before. And especially then when she returns back to work, it's like, what is going on? They do say it takes a village, and it's true. And there's no shame in asking for help. And I think the whole family benefits when there's this team approach.
Well, I do have to say that I think because there's gender inequity in our workforce, that this translates. This is a manifestation of it, and I'll give you an example. The first practice I joined in 1995 was 3 men and myself, or 4 men, I guess, and myself. And the day after I had my baby, they called me and said, "Well, are you coming back today or tomorrow?" And I said, I thought I had maternity leave. And they said, "Well, we didn't take any maternity leave when our kids were born, and we expect you to get right back to work." And I said, I'm not going to be able to. I'm really anemic and I lost a lot of blood. And they said, "Well, if you're not able to pull your weight and be back here immediately, you're at least going to be doing all our paperwork." So they would send crates and crates of their paperwork, and I would do that. And I didn't have the guts to push back and say, "No, this isn't right."
No. And you don't have that conversation with a woman right after she gives birth.
They were OB-GYNs, but because they made me feel it was wrong that I wasn't pulling my weight like
Right.
they pulled their weight.
Right.
And I felt like saying, "You didn't have a perineum that was cut. You didn't have stitches. You're not up at night breastfeeding." But I didn't have the guts to say that. And I wanted to show them that I could exist in their world and be as valuable to the team as they were leading me to believe I wasn't.
Right.
And I think versions of that happen. I mean, this was 1995, so hopefully things have changed, but I think versions of it still happen.
I agree.
I think it's okay to say, I'm a woman, I have breasts, society or someone has deemed that I'm this gender that's going to give milk to this baby and bear the baby. And so for that, I need to be compensated a little bit with, if nothing else, just some rest and peace and healing time. And I say it having failed that ability to do that myself.
Yeah, I do see, I'm hearing, families in my practice where more and more dads are taking paternity leave. And I'm just so happy when I see that, because I even remember about 10 years ago in practice where dads were like, well, my company offers it, but none of the other men take it. And so I look, foolish to actually do more than a week, let's say, but their company offers 2 months or 3 months of paternity leave. Right. So, and what happens because of that, it's like, yeah, the man didn't give birth, but how much can he support his wife and child?
A lot, actually.
A lot.
Other children, right?
Especially if there's other children. And so that paternity leave is also valuable. Both are very valuable.
I've had patients where the husband takes paternity leave, or the partner does,
Right.
or even in a same-sex couple, the partner who didn't give
Give
birth
birth.
takes the leave,
Yep.
and they handle the other kids, the cooking, the cleaning, the taxes, the bills, the lawnmower breaking, the 100 things in a normal life that happen, that if you're the one home recovering from having a baby, that's all going to just dump on you because you're at home. And this way, that partner says, no, I will do that. You heal. Or if you're feeling well, you start back to your online job, be a podcaster and tape some tape some episodes, whatever it is, so that you can feel that your job hasn't taken this massive 9-month gap and now you're going to be demoted. I mean, there's a lot of women feel really sad about that sometimes.
Yeah, it's so true. So, I mean, we talk a lot about in this podcast about communication between your partner and, even what you're just saying about what happened at your job, communication before you gave birth would have been very helpful because, it might have been easier when you were pregnant to be like, listen, that's not okay. I haven't given birth yet. I don't know what it's going to be like after I give birth, but I take care of women after they give birth. And I know that nobody wants to go back to work 1 or 2 days after they've given birth. Like that is just unacceptable.
Right.
And
it never crossed my mind that as OB-GYNs, they would be that insensitive. You know what I mean? I think
that is so insensitive.
Yeah. I think I was in shock. And then once they started shipping all the paperwork, I didn't have they made me feel that if I didn't do it, I would be not pulling my weight.
Right.
And it was that whole feeling of you're not you're not a real doctor, you're not really pulling your weight. And it was a horrible feeling because I wanted to be a good mother.
Right.
Was too embarrassed to fail at work,
Right.
And so I think we've come a long way since then, to be honest. I can't imagine someone pulling that today, but you never know.
Yeah. And to your point, it might be versions of that. And I think really, that goes back to communication. Like, okay, this is the expectations. I have a 3-month maternity leave. And, like all of these things can be between partners as well as between you're at work. Right? Like this is what I'm looking for. And also recognizing that you don't really know what your life's going to be like until you have a baby. So there has to be some adaptability that's available as well. Like, if you're having depression, then your mental health comes first, so.
And I would say if you're not sure, like if you have an inkling, but you're not sure, because I have a lot of patients that say, I don't think I'm depressed. I just have no appetite. I don't see any joy in anything. I don't laugh at funny movies anymore. I don't even want to see a funny movie. That's enough. That's enough. You don't have to be suicidal. You don't have to be crying all the time. If you are not you, and if you used to, laugh at rom-coms and whatever, and now you're watching it and it seems bland.
Yeah.
Maybe it's just lack of sleep, but maybe there's something more to it. And it's so important to ask for help about that. It really is, about mood stuff.
Yeah. And there's a lot of support groups out there available to get that type of support. And I think it's also nice to recognize that you're not alone. So even sometimes like the group supports can be helpful, where you talk with other women that are going through similar, they're also new moms and they're also, feeling, challenges, because I think there's like shame with that as well. Like, okay, I have to be perfect. I have to do it. And then I can't talk to anyone else about it. Right. And because obviously all these other moms around me are succeeding and I'm not, right?
Right. It always seems like they are, and they have the perfect stroller and they figured out the perfect breast pump and they pump flawlessly and nobody has sore nipples and da-da-da. And you're feeling like you're just falling apart. And, that's not uncommon. That's no different than the high school locker room where it looks like everyone else is just sailing, on through their sports and you're struggling. And, or my son, when he got to college, said it's like the duck syndrome. Everyone's floating on the lake, but they're actually pedaling furiously underneath. And so I think, and again, I hope your clinicians will be an empathic ear, but if they're not, go to a support group, go on Facebook, go on whatever, you use, or look in your neighborhood. I mean, sometimes next door, the next door, whatever county you're in, even has groups of women. I gave birth to a child in Switzerland, and there were just lovely women's groups that would meet and talk about what to feed the baby, when to start feeding, all these things that kind of talk to the pediatrician about, but you could do it in a more kind of relaxed, warm way and share things. So I agree with you.
Yeah. And I think that's the beauty of social media. You can find these types of groups. If you're more crunchy, they have the crunchy moms groups and, things like that, that are like-minded, right? Because not all moms have the same views, right? And so it's nice to be with your tribe. And if they don't live in your town, you can still find them and connect. And I think that community, like finding your community, is so valuable.
Agreed. And Laura, I think what you're doing is so valuable, to be able to have a place and a space. Women can listen to this in the comfort of their home, their car, whenever. They can re-listen to it. They can find experts in certain aspects of this if you want. And, I hope today there's some way you can get them, ASECT, so they know they can go to ASECT if they need counseling. I'm sure you have some sort of list of pelvic floor physical therapists, or a way. Same thing. There's a national website, and people can put their zip code in and find a good pelvic floor physical therapist, because not everybody knows about these things.
Right. I have one right in my office. So it's really wonderful. We can co-treat and support women that are, going through like just a lot of change, musculoskeletal changes, right? And how, you don't have to live with pain, whether it's pelvic pain or back pain or, breastfeeding posture pain. Like there is ways that you can feel good and that are drug-free. And I love that you were giving some options around that too for the sexual health. Is like, did you have any other things you wanted to share about sexual health from a healing perspective after giving birth?
Well, they're really kind of holistic things, because where you start depends on how you are after the delivery. And as I said, some people are really, I hate to say it, beat up in a way, or tender, or cuts or tears or whatever. And other people are fine. But remember, it's not always going to be, I would say the most important thing is to get back into sex at your own pace, and not be afraid to have sex take on sort of a different script in the beginning, which could be just cuddling, or not focus on orgasm, not focus on penetration. Some of these sort of sexual milestones that, if you think about it, who came up with those sexual milestones? Men. Because if you orgasm, it makes them feel great. And if they have penetrative sex and they can ejaculate, that's great, but that may not be your definition of an enjoyable sexual experience. And when you have all those other factors we talked about, of the no sleep and emotion and vaginal cuts, you should not have to be held to what I call an androcentric model of sex, a male created sexual script. You can make your own sexual script. And we talk about that in my practice in Princeton a lot, is creating a sexual script that works for you, so that what happens in the bedroom, at least in the beginning, as you're getting back into being sexually active, can be something enjoyable, if at the very least palatable. And so that you don't feel thrust back into having to perform and be something that you're not ready to be.
That's such a good point.
October on this. But it's really sex in midlife and what happens to that. But it applies to all women, because it talks about this scripting and how we as women are kind of trained, whether it's through media, social media, our friends, our mothers, or whoever, to assume some sort of role that was really created for us thousands of years ago by men for male sexual pleasure. And I would say, don't forget to advocate for your own sexual pleasure. And if that does not include penetrative sex in the first few months after you have a baby, so be it.
Right. And I really love that this could be a woman who enjoyed that even during the pregnancy, right? And now postpartum, those first weeks or months, that's not enjoyable. That's not, and that doesn't mean that she doesn't have any type of loving physical contact with her partner. So it just, there's an awareness. I think this is just, you really hit it on the head as women. we have life cycles, right? And we go through these different changes, and things do change. And when we're really in touch with our intuition and what our needs are, then we're getting our needs met.
Yes. Yes.
And we're communicating that.
We're better partners,
And we're better partners, we're better mothers, we're better professionally, everything, right? And this applies to all areas of our life. But when we're like, well, I used to like it, so something's wrong with me now because I don't like it anymore, then that's where I think we start to, judge ourselves. We start to feel ashamed. We start to kind of suppress, right? That's where the wine comes in, suppress, instead of being like, well, what's going on here? I'm curious. Why? And my body's still healing. Okay. So what does that mean? I still want to be a sexual being. And, what does that look like? And, these are really important conversations to have, first with yourself and then with others around you that are relevant. And, I think you also really made a good point. If your practitioner is really not kind of meeting your needs around this topic, then you can find people online that are therapists or OB-GYNs that do specialize in sexual health that can help you, navigate this area, because it's a lot to navigate.
Yes, it is. And it's an awkward topic, and sex is an awkward topic for most people. So I think that's another reason why most women are loath to bring it up. Most clinicians are loath to engage. And, the sex ed we're taught in 7th grade or whatever is so inadequate for all of this.
Mm-hmm.
And there's no such thing. We don't really have peripartum or pregnancy sex ed much. I'm sure there's a little chapter in every pregnancy book, but, which just says, don't worry, you won't hurt the baby or something. And that's
right.
not at all what you and I are talking about. That baby's in a little fortress. It's not going to get hurt.
Yeah, that baby's fine.
That baby's fine. I think there needs to be another chapter. Maybe you need to write it, Laura. Maybe you and I need to write it about, you, the mom, and your sexual needs.
Yeah.
Pregnancy and postpartum. So,
and actually, we didn't really cover this, but the sexual health during pregnancy as well. Like, some women feel like they want more sex, because of the hormonal changes, or some women, like you said, have this unconscious fear that, or even the dads have an unconscious fear that they're hurting the baby. But it's like, or certain positions aren't comfortable anymore as the pregnancy progresses. So it's just really being like, okay, what worked for me a month ago isn't working now. And, it goes back to that adaptability and seeing like, well, let's find something new. And I think there's some sense of humor that can be involved there, especially with partners that are having sex with each other. Like, okay, we gotta switch it. I'll never forget. Actually, I'm going to share a pregnant sexual story, a personal pregnant sexual story. I was probably 14, 15 weeks pregnant, barely showing, but maybe a few pounds heavier, right? And my husband turned me in bed, to get me on top. And he's like, oh, you've gained weight. And I'm like, you asshole, I'm pregnant. Of course I've gained weight. Like, that's not what you say when you want to have sex with a woman. Right. Right. So that was kind of funny, but we laughed about it. Right. Like, it was like, come on, he was still learning how to talk around a pregnant woman. And I think it's funny for dads too, because they're not feeling all those changes, so to speak, that's going on within that woman's body. And so it's like, until you really are popping, sometimes they almost forget, right? Like that you're making a baby.
Well, yes. But in a way, I think it's okay, because I think I just think the more couples sort of almost disregard the pregnancy and just keep having sex, I hate to sound like that, but the more they can say, look, this is a pregnancy. This isn't like, a nuclear explosion. Like, we can still be a couple, because you need to keep your marriage healthy and fun, and sex is a part of it. So that's all,
One last thing. What about for families that are co-sleeping with their baby? Any tips for keeping their sex life alive?
Yeah, I mean, well, you could view it this way. If that's super important to you, because I'm not going to tell someone, no, put the baby in another room for goodness sake, although part of me wants to say that. But people who want to sleep with their baby have every right to that. But it is, in general, a killer for intimacy. So I would say use it as an excuse to explore some fresh and spontaneous sex in a chair or a shower,
Different
or
room.
if the baby's with a nanny for an hour or something like that.
Yeah.
Go into your guest bedroom or go into the baby's room and say, "Oh my gosh, we're gonna have sex in this sacred place." I think you could almost use it as a fun kind of excuse to do something else.
Yeah. I love it. Well, any last thoughts you want to share with the audience?
No, I think, Laura, we've covered so much, and I really thank you for having me. I've really enjoyed talking with you. I hope we can do it again and find another mutually fun topic
Yes.
to chat about. And I hope people, take from this that sexual pleasure is absolutely yours, and you're entitled to it, and you can have it in pregnancy and after.
Wonderful. Well said. Thank you, Dr. Sophocles.
Take care. Have a great rest of your day. Bye-bye.
Thank you. Bye. I hope you enjoyed today's episode with Dr. Sophocles. She's definitely extremely passionate about women's sexual health and supporting women that are having challenges in that area through non-invasive drug-free options, which are typically very effective and safe. And also recognizing that menopause is a natural, normal transition. And there's a lot women can do to feel really great during that transition as well and not suffer. And actually, a lot of women that are older moms find themselves in perimenopause somewhat soon after giving birth. So I'm hopeful that women listening that might be in that perimenopause stage will learn a lot and feel really educated for the transition that is occurring. All right. Thanks again for joining.